Yeah, and it's working. Oh, it's dark though. Hey, everybody, welcome back to the Unstruggle Mindset podcast. I'm your host, Ryan Glenn. In this episode, we are doing part 2 of our Gastroparesis Awareness Month series. Today, I have Robyn on. And Robyn, how are you doing?
I'm doing.
I guess it's
I don't know if I
can
call it good, but I'm doing. I'm
So,
opening alcohol.
So, for those that are tuning in, I know, gastroparesis, we don't know. I haven't really found anything about it until I seen Lauren's post. I had no idea it even existed. So, do you want to explain a little bit about yourself and a little bit about gastroparesis?
Sure. Well, for starters, Lauren is excellent about raising awareness, and you know what I mean? She's always got these ideas, and
That's good.
she just doesn't really about catching people's eye. You know what I mean? She's great about it. I've actually learned a lot about it because of her. She is actually who told me which doctors I should go to because she thought that's what was going on with me. So she kind of diagnosed me, and she was right. It means paralyzed stomach. Your stomach is partially paralyzed, and your small intestines, they don't work. And it's not an all, well, for me, it's not an all the time thing. For some people it is. I mean, there's people who end up with getting their entire stomachs removed because of it. But mine is, it's not controlled exactly, but I'm able to do a lot more than some of the more severe patients. It makes us where we can't eat. That's pretty much the basis to it. We don't digest anything. We don't absorb like vitamins or minerals or any of the good stuff we're supposed to absorb. And for some reason, things like sugar, it's fine. We can eat all the sugar we want to. And that's why most of us end up with diabetes or gaining weight.
Right. So I know we talked about it, but for those that are tuning in, do you want to explain to them a little bit about what you're doing right now?
I tried to get all this done before we signed on, but I had too much to do. I am at the moment getting ready to administer Zofran and then set up my fluids, my lovely bag of saline there that I have to do every single day. And then Zofran.
Now I'm a little familiar with Zofran from my wife was on Zofran while she was pregnant. I know it's some good stuff. It can be, at least.
Yeah. I got it at first in the pill form, but then they weren't absorbing. I wasn't getting any benefit from them. So they make a dissolvable one that goes under your tongue. And I tried those for a while, and I end up having to take more than I should of them to get them to work. So she finally just gave it to me by IV because I have a PICC line in my arm.
Wow. Okay.
Yeah. I know Lauren showed you, she's got a chest port.
Right.
But that's because she had IVIG therapy, which is, I don't understand it exactly. It's an immunoglobulin therapy. It helps with if you have certain antibodies or certain disorders. It can help get them under control. And I think that's why she took it, was because she's got some sort of antibody issue.
Okay. So how long have you yourself had gastroparesis, or how long have you officially been diagnosed?
I'm going on 3 years now. I've had this PICC line twice. I ended up with sepsis back in February, and I was in the hospital for about 7 days. And then I came home with a PICC line because I had to be on an antibiotic for like 4 weeks. And then I guess my body tolerated the PICC well enough that my gastro doctor was like, we want to put a permanent one in so that, I can start getting fluids without having to I was having to go down to the Brown Cancer Center like 4 times a week. for 3-hour infusions every day. And, it was a little much. So now I can do it all at home,
Oh my
which
gosh.
is much easier, much easier.
Well, that pretty much answers one of my questions too, because I know with gastroparesis, there's a lot of stuff that you guys can't do, and I know there's a lot of limitations that you face. So one of my questions, of course, is the limitations that you face on a daily basis, and I'm guessing with all that, you've got quite a few.
I don't do anything. I stay home. I really don't. I barely leave my house, and if I do, it's for a doctor's appointment or like the grocery store, and that's all I do. But I've also got mast cell activation disease, which is where my body overproduces histamine.
Oh, okay.
And it causes me to have allergic reactions to things that I've never been allergic to before. I have 64 medication allergies now.
Wow.
I'm allergic to all the standard antibiotics, like all the ones that everybody knows about. I can't take any of those. When I had sepsis, they had to bring in 4 different specialists to figure out which antibiotic to give me, so I wouldn't go into anaphylaxis on top of it.
Oh my goodness.
Yeah, it's a pain. It really is.
So in the last 3 years since you've been officially diagnosed, how do you feel your medical treatment has been along your journey?
Well, at first, all I had was my primary care doctor, and she referred me to, a gastro doctor. But after trying a few tests, like she did the gastric emptying test on me, which is the main one they use to diagnose gastroparesis, and it's where they you eat a radioactive egg.
Oh gosh.
Yeah, it's weird. It doesn't taste bad though. It really don't. It just tasted like an egg. But it can be a 2-hour, a 4-hour, a 6-hour test, and you eat the egg, and they scan you right away, and then they wait an hour and scan you again, and they do it every hour. For mine was supposed to be 4 hours, and it just shows them how quickly or slowly it's moving through your system. And at the 2-hour mark, I was sitting out in the waiting room, and sorry in advance, but I projectile vomited all over the floor.
Oh gosh.
I felt awful. Like I felt so bad because, somebody has to clean that.
Yeah.
But they had to void the test. Like after that, there's no more egg in me. So the test was no good. They had to just stop it, and I went home. But my doctor that I was seeing then, she was just with Norton's. And she was like, I hate to say this, but you're over my head. She's like, I have to refer you out because I'm out of ideas. So she sent me to Dr. Stalker, which is the doctor at the U of L motility clinic.
Okay.
Same one that Lauren sees. And she is a specialist for GP. People come from everywhere to see her. Like there's a support group on Facebook that I'm in, and everybody in that group knows her. Like the whole world knows her name. And people come from, everywhere. I know somebody that lives in Michigan that comes all the way down here just so they can see Stalker.
Oh my goodness.
She really is the best doctor I've ever had in my life. I could email her at midnight, and by 12:30, she'll write me back. On Sunday, she'd write me back. She's just very caring. She's a great doctor, and I feel very fortunate that I was referred to her.
It's great. It's great. I'm so glad that you were able to find the not only a good physician, but the best, and apparently one of the only. So
yeah, it's not a well-known disease. It's becoming more well-known, as more people get it or whatever. But I never knew the name until Lauren was diagnosed with it.
Right.
But then again, I'd never heard of mast cell activation disease neither until I was diagnosed with it.
Right. So I couldn't help but notice in all of the information that I found online, and then of course talking with you and Lauren and a couple of the others, I found that a lot of people that are diagnosed with gastroparesis are women. Have you ever met a man that was diagnosed with gastroparesis, or is it more common in women?
I don't think it is, but you're right. I do know of one man from the support group, but no, I mean, yeah, now that you mention it, they're all women.
They're all women. Even if you follow the hashtags for gastroparesis on Facebook or Instagram, all the posts are women. And
Yeah, you're right.
I was like, that is the weirdest thing I've ever seen. I haven't found a single man that's been diagnosed with gastroparesis. So that's really interesting. And if anybody from the scientific community or the medical community is watching this, you should look into that shit. That's something wrong there.
Right. I'd never really thought about that, but yeah, I mean, you're absolutely right. It is the majority of women. I see a lot of people that come on the support groups that are like a spouse, my wife has this and I want to know more, or my daughter, you know what I mean? There's a lot of people in there also that don't have it, that are just there to learn how to support their loved one better.
Right. That is a lot of work you're doing there. You have to do that every single day.
Yeah. Yeah. And this one, the Zofran, is every 4 hours.
Wow. That is a lot of work.
Yeah, you feel like I feel like I should be certified in something.
You should, yeah, definitely. Definitely. That you definitely meet the job criteria somewhere.
I should get paid for this. I'm trying to get paid. Actually, I've filed for disability. I've been denied twice, and I'm waiting now for my court date to go before the judge. But because of COVID, luckily, and this is a great part, my visit with the judge gets to be either by video or just over the phone.
Okay, good.
I don't have to go in person, and that's God, that like released 80% of my anxiety about it.
Yeah, because I'm guessing going out into the public, especially with everything going on right now, you all got to be on high anxiety 24/7, right?
Oh yeah, we got to make sure we stay healthy. And mine, with the added crap of the mast cell issues, I can't take the COVID vaccine.
Oh my goodness.
Yeah, so I just stay home. My fiance did take it because he works and whatever, and he wants to keep me safe because
right,
we like that. But I can't take it, so I always wear my mask everywhere I go. Even if I answer the door for like deliveries or something, I still wear my mask.
right.
I don't take chances because I'm afraid. I really do think COVID would kill me.
Right. One wrong move and it would end everything.
Yeah, I think it would. I don't think my immune system would be able to handle it. So that's pretty terrifying.
I could only imagine. Well, when I talked with Lauren, we talked a little bit about her relationship with Josh and everything. So how do you feel your gastroparesis? Do you feel that it limits your relationship with your fiance, or is he pretty supportive? And
yeah, he's extremely supportive. It's almost annoying sometimes.
That's the same thing Lauren said with Josh.
Not to be all, TMI or nothing, but one of the main things that it does affect is our sex life, because I'm always bloated. I'm always in pain with cramps or throwing up or constipation, and ain't none of that sexy. But I don't worry. He's super understanding. He really is. Charlie's a really good guy. I'm very fortunate and lucky he's mine. But we don't go out and do anything anymore. And some of that is COVID also,
Right.
But we can't go out to eat. There's really no point. He could eat, I couldn't. And if I did, I'd feel like crap. So
yeah,
it really does limit it. Like, we don't want to go to like the movies or nothing. I can't sit there, and I can eat some candy, but you get tired of that too.
Yeah. And then that's going to start affecting other things. You eat nothing but sugar and candy all the time. Then you got your teeth to worry about and like you said, the diabetes and everything else. So it's a never ending circle, it seems, for you guys.
Yeah, it is. Our teeth, since you mentioned it, we do get sick a lot, and that eats away at our teeth too.
Huh.
Like more, well, I mean, like, I guess the same thing happens with like bulimia.
Right.
They end up losing a lot of their teeth too because of it. It's like it's just the stomach acid, I guess, is what it is.
Right. The acid from the vomit. Yeah.
Yeah. We also end up with, like ulcers in our throat, sores in our throat from the same thing. And sorry, the Zofran, you can't just give it to you. So it's got to be over between 3 and 5 minutes. So every once in a while, I got to push my little plunger down.
Oh, that's okay.
I forgot what I was saying. Brain fog's a big issue too, because we can't eat right. So we never have any energy, and your brain just starts to, I don't know, you lose track in the middle of a sentence. You forget to do shit that is a normal routine for you. You know what I mean?
Right.
It can be very hard.
I can only imagine. And that kind of segues into my next question here. With everything going on, and of course not being able to digest the nutrients that your brain needs, how do you find yourself day to day trying to remain positive in the middle of all this? Of course, my podcast is the Unstruggle Mindset podcast, so I try to focus a lot on mindset. How do you keep a positive mindset? I mean, I'm sure it's a chore with everything else going on.
It is. I've never been somebody that I consider healthy. I've always had some sort of issue. And a lot of that was always the things that I'm now diagnosed with.
Right.
If that makes, you know what I mean? Like, looking back, now that I know what everything is and what it does and how it makes me feel, I can look back on pretty much my whole life and see where I've probably had these things for a long time.
Right.
They weren't diagnosed or noticed right. Because up until like 3 years ago, I had never had to see a specialist for anything. It's always just been my normal primary care doctor and general wellness visits, and you know what I mean? But now I have 9 doctors and they're all specialists in different fields. I have an immunologist, a cardiologist, a gastroenterologist, my migraine doctor. I have 3 neurologists because I have a lot of different migraine issues. I've got just a lot of crap going on.
Right. And, to be quite honest, for myself, a lot of people don't know this, but I was actually diagnosed at birth with cerebral palsy. I was just really blessed that mine is very, very mild. It's just my muscles in my legs and my back are 45% tighter than the average human being. And then I also have ulcerative colitis and I have irritable bowel syndrome. And, I was going through life and I was like, oh my God, my stomach hurts so bad. And, my back hurts, my leg hurt. I was constantly complaining and focusing on the pain. And then that's kind of what led me to follow Lauren's journey a little bit more. Cause I was like, holy shit, like I was being a baby because the stuff that you guys go through, I mean, my pain doesn't even compare. Like just watching Lauren go through everything and the bloating alone. I mean, if I get bloated, I lay in bed, I'm done.
Yeah. The bloating is awful. It's almost constant. I'm bloated now. I weigh 121 pounds. I'm a thin person.
Right.
I always have been. And there's times when I look like I'm 8 months pregnant.
Right.
And you can't, I have clothes in like 4 different sizes. Do you know what I mean? It just depends on the day as to what size I am. But don't downplay what you're going through either. Ulcerative colitis can be, it can be devastating. A good friend of mine had most of her colon removed because of it.
Wow.
Yes, it's a pretty brutal disease if it wants to be. And so is IBS. I mean, anything that affects your stomach is awful because, eating is one of the main parts of being alive.
Right, exactly. And it's the thing I enjoy the most.
Yeah. I mean, I used to really enjoy it, but anymore, it almost makes me anxious to try.
Right.
And that sucks because, I don't want food to scare me.
Right. Right. It's like sticking your hand in a thorn bush to get a burger every time.
Yep.
You know it's going to hurt, but is it worth it?
Yeah. And sometimes I go on and eat anyway. Sometimes I'm just like, fuck it, because
Right.
I got some tacos. We went to Taco Bell the other night and I got me 2 steak soft tacos and I sat here and ate them and they were delicious.
Mm-hmm.
And to say that Taco Bell was delicious, I had to be hungry.
Right.
And then you pay for it. But it was worth it to me because I hadn't had anything in so long. I've gone 11 days now and all I've really eaten was that Taco Bell.
Oh my gosh.
Otherwise, I snack, I eat. I can handle, my belly will allow ranch Doritos
Mm-hmm.
and those little spearmint gum things that look like a leaf. You know what I'm talking about?
Yeah.
Like dollar bags or whatever.
Mm-hmm.
Those that and ranch Doritos. Those are the 2 things that I can tolerate. And for days at a time, that's all I eat. But I don't lose weight. It's the dumbest thing in the world. It's awful. It really is. Sorry, I'm trying to get all this stuff open over here. I have to hook up my IV line now.
Oh my gosh. So how long does it usually take you every day to do all that?
7 hours.
Oh my gosh.
Yeah. I have to run this thing. And I even try to speed it up sometimes because I get tired of sitting here on it.
Right.
I want to go get in the tub or something, you know what I mean? And it's
right.
So I put it on just open and just let it pour.
Right.
Which I'm supposed to do, but it's aggravating. And sometimes you're just like, screw it, I'm gonna do it anyway.
Yeah. So is it the same kind of deal as Lauren where you can't digest, like the water makes you really sick? So that's how you stay hydrated?
Yep. I'm completely water intolerant.
Oh my gosh. Completely water intolerant.
Yep. And nobody can fathom that. Anytime you say that to somebody, they're like, now I don't even understand that because there's nothing in water. Well,
right.
I don't know how to explain it, but we can't have it.
You'll probably have those judgmental people like, oh, that's just an excuse. You don't want to drink water. You want to drink your soda pop or something like
that. Yep. I live off Pepsi. Really. And because of that and the candy, I'm going to end up diabetic. The last 3 blood draws they did on me for fasting glucose or whatever, it's supposed to be like 109 or something like that. And my first one was like 127. My second one was like 138. And then my third one was 142. So I'm steadily headed towards diabetes.
You're knocking on the door. Yeah.
Yeah. I'm skipping down the path. And that is something I hope does not happen because I don't want to have to deal with that. I had my ex, I still call him my stepson because I was with my ex for 7 years and I loved his kids. I still love his kids. So they're still my step babies. Right. And he has diabetes. He was diagnosed at like 9 years old. So we had to, sorry.
No, you're perfectly fine. And, I just want to point out for all the people watching this on YouTube, just to see the struggles that you all go through on the daily, and then your cell phone camera falls over while you're doing it.
And I forgot to close it off and it leaked on me.
Oh, goodness.
I just got my butt wet.
So I've done a lot of research since I started talking to everybody about this. And, I've found a couple clinical trials, but none of the clinical trials have shown any kind of result.
Yeah, they don't. Sorry, I'm sorry I got my boobs all up in the camera here, but
you're okay. You're
I
okay.
can't get there it goes. It's a little crooked, but I got it to stay. So man, yeah, see, I have to prime this tube, and everything's got these stupid clamps on them.
Oh yeah.
And I didn't check it because I wasn't paying attention, and it was open. And as soon as I put it up, gravity started working. It was back here. There's a big old puddle on my couch now.
Oh my gosh. So in the 3 years that you've been diagnosed with it and going through everything, how do you feel the medical community is growing in order to better treat? Do you feel like there's anything going on, or is there any kind of training or any kind of doctors that are coming into the specialty to kind of try to nip it in the bud or anything?
The only doctor I have that seems to even slightly understand it is my motility doctor, Dr. Stalker.
Oh my gosh.
My primary care doctor, actually, it's like, I don't know, she ignores it. Her favorite thing to say to me is, if you could just get some water in you. And it's like, bitch, look, I can't. You know what I mean?
Yeah.
I can't. And so, yeah, I mean, there's a lot of doctors that are just dumb. And they're real dumb to my mast cell issues. Anytime I tell them I have MCAS, they're like, what? It's like they never heard of it. So, yeah, it's hard to find and never go to an ER.
Oh my gosh. Especially right now, I'm guessing.
Well, there's just no point. They treat you like you're full of crap. All they're going to do is give you some fluids and, check your vitals and then send you on your way with a referral. And that's all they do. No matter what you go in there for, it's like they don't give a shit. They think you're, lying to them.
Right.
And they have no idea how to treat you. So most of us will just sit at home miserable instead of going to an ER.
Oh my gosh.
Yeah, there's no point. None at all. An example, and Lauren, did your interview with you, so she probably won't. I hope she don't mind me sharing this, but when it comes to medications, we don't always absorb them, like pills especially. We swallow them, they go down, they find a place to sit, and they just chill there. They don't dissolve, they don't activate. And because of it, like, especially if it's for nausea or pain, any person in the world is going to go on and take another one because that one didn't do it. So you're going to take a second one. And then even if you're prescribed, like, say, every 6 hours, that's 4 a day. And you take all 4 of those. And if it's something really strong, like Percocet, for example, and you take those 4 and they sit in a spot, and then they decide, oh, we're going to go on and dissolve now. So instead of one at a time, like it was supposed to be, you get all 4 hit you at once.
Oh my God.
And you end up overdose. You know what I mean? And that happened to her once. And she ended up at the hospital because of it. And all they did, and she was like full blown hallucinating. And they just left her in a freaking room with some fluids.
Oh my gosh.
It's awful the way they treat us. And none of us are. I have an addiction past. I do. But it was 8 years ago. I've grown up so much since then. I have no interest in that. I smoke weed. That's the only way I get high.
Right.
And they treat you like you're completely, a pill seeker. And it's like, lady, if you go through this for 1 day and then tell me that you don't want some fucking pain medication,
right,
or medication, or something like that. They really need to legalize marijuana.
So does the marijuana help?
It does me. There's a lot of people it doesn't help. I'm not sure this is going to work.
I've been curious about that, so I'm glad you kind of brought that up.
Yes, marijuana helps me a whole lot, and it helps a lot of people I know a whole lot, because along with being excellent for nausea, it's really good for pain. It's really good for anxiety. Right. It's good for sleep. It's good for everything. And why they should just medically, it shouldn't even be an issue. Right. You know what I mean? It's been proven time and time again. There's little bitty kids out here with epilepsy that, their parents have to sit and just watch them seize. And you can just take a roller on their foot, with some THC and it stops.
Right.
Why isn't that legal? You know what I mean?
Right.
It's ridiculous. There's
Yeah,
no reason.
I mean, from my observation, I mean, this is just my opinion, but it's my podcast, so I guess I can give my opinion. But I feel like the medical community, their policy is treat everybody like a drug addict to prevent becoming a drug addict.
Yep, it really is. You definitely don't get that innocent till proven guilty thing. You're just guilty until proven innocent.
Right. And I mean, I've been in the hospital before and seen the, apparently drug addicts come in and, it's kind of like they just push them on out the door, but then that's the way they do everybody. It doesn't matter what's going on. Oh, I'm sorry you broke your leg. Here's a couple 800 milligram Motrin and call me in the morning. You froze up a little bit. Are you still there? Well, it looks like Robyn's having technical difficulties with her camera. Not sure if it's going to unfreeze or. But I mean, that basically wraps up the episode. Mm-hmm. Oh, there you go. Are you there? Okay, she's reconnecting. It will be nice once all this COVID stuff is over to actually do things in person again and not have to worry about the Zoom stuff.
Okay. Are you there?
Good now? Yep, I'm here.
I'm sorry. My phone rang.
Oh, that's okay.
It screwed me all up. I'm trying to figure this thing out. I've never had this happen before.
Uh-oh.
This little tube is supposed to be this thing.
Mm-hmm.
It's supposed to be only half full and it's completely full.
Uh-oh.
So I'm just going to empty some of it.
I'm no medical professional, but I've been hooked up to those things enough. Is the drip turned is it turned on?
Yeah, I think because I had it open when I first plugged it in.
Oh, okay.
And I wasn't supposed to. I think I got it fixed now though. And they just throw all this shit at you too. You know what I mean? They send it in the mail. You get it on your porch and it's like, okay, figure out how to use it.
Right. Like check YouTube. I'm sure there'll be some kind of instruction.
Yeah, you can do anything. You can learn anything you want on YouTube. I learned how to use the app Quicken. For financial things or whatever.
Yeah.
I taught myself how to use that one from YouTube.
Well, that's cool.
Okay, I think I'm good now.
All right. So, Robyn, I see you got to put a lot of work in every day just to handle the disease. With everything going on with gastroparesis and the little known about it, what are your hopes for the future for not only gastroparesis but for yourself?
I hope that I can get to where I can eat, and I need to get more awareness so that especially like ER doctors know how to treat us.
Right.
I wanted to approve medications. There's one called domperidone. It's something like that, and it's legal everywhere but here. Our FDA hasn't approved it, but it apparently is a wonderful medication. We can be prescribed it, but you have to find like a pharmacy in Canada or something that you order it from.
Oh my gosh.
Yeah, and it's a pain and it's expensive.
Right.
But it supposedly helps improve motility. Only medication that is actually for gastroparesis is called Reglan.
Uh-huh.
And it has a black box warning on it.
Oh wow.
Because it causes tardive dyskinesia.
Mm-hmm.
It's where you have uncontrolled muscle movements.
Oh, wow.
And if it gives you that, if you have that side effect of it, it's permanent. It never goes away. Even after you stop the medicine, you will always have that side effect from it.
Oh my gosh.
So that makes a lot of people not even want to try it. And it is literally the only medication that is for gastroparesis. We take things like Linzess, Trulance, and Motegrity, and they're supposed to help, move along, get your whatever moving motility, but it doesn't work. None of them have worked for me. I'm on Motegrity now, but I take it, but it doesn't seem like it does anything at all.
Right.
Zofran is my best friend.
Yeah. Well,
And Phenergan.
Yeah, Phenergan was the first medicine that I took after I got diagnosed with ulcerative colitis. And it was amazing. It was a lifesaver for me.
It'll put you to sleep, though.
Oh yeah, it knocked me on my butt. I'm almost 300 pounds, so.
I only take it at nighttime because of that. If not, I would sleep all damn day.
Mm-hmm.
The amount I'm prescribed is insane. The bottles are this big, and I get 4 of them.
Oh wow.
Yeah, 4 of these damn things a month, and
Wow.
it tastes awful. It says it's pineapple, but whoever said that has never in their life tasted a pineapple, because that is not pineapple. It's pretty terrible.
Well, Robyn, that's all the questions that I had for you. And I really, really greatly appreciate your time. And, even with everything you had going on, hooking everything up, I appreciate you coming on the show and talking with me and, just giving everybody a little preview of the things you have to go through every single day just to combat this disease that nobody in the medical community knows anything about.
Yeah.
So do you have any kind of personal message? I'm sorry.
It was fun. I'm glad you let me be a part of it.
Absolutely.
Anybody out there, for real, even if they think they have it or they might have it, find me. Look me up. I'm on Facebook, Instagram, TikTok. I'm on all of them, but find me. I'm happy to talk to anybody and help anybody, get to the right doctors or know what to say to their doctors, or you know what I mean? So yeah, anybody. I will help for anything.
That's awesome. I'm sure everybody out there greatly appreciates. I know you all have built a little community and you all kind of talk to each other and help each other. And, as an outsider looking,
yeah, we do.
I greatly respect that. And, I was talking to Lauren, I was like, you guys built a little tribe going on here. And she's like, hey, I've got some other people that want to do the podcast. And I was like, Lauren, we're going to have to shoot a full on documentary. But I'm so glad you guys have a support network. Thank you so much, Robyn, for your time today. And I hope everything goes well for you. I wish you the best. I wish all of you the best, and anything I can do to help raise awareness. I've been told that there is a website, curegp.org, where you can go and donate money and help in the medical testing and the medical training that is desperately needed for gastroparesis. But Robyn, thank you so much for your time, and I appreciate it. Have a great day.
Thank you for talking. You too.